Good morning and welcome to Southern Maine Healthcare's Medically Speaking. I'm your host, Robert Erickson, and for the next 30 minutes, you'll hear about medical issues and topics of the day directly from leading medical professionals at Southern Maine Healthcare. My guest today is Deborah Brown, a certified smoking cessation specialist at SMHC. Deborah is here to tell us about tools you can use to stop smoking. Welcome, Deborah.
Thank you so much for having me.
We always like to begin our shows by finding out a little bit about our guests and how they ended up in the field of medicine. How did you begin your career as a nurse and then a smoking cessation specialist?
I started my nursing career working as an emergency department nurse for many years, and 18 years ago, I joined the cardiac rehab staff because I did have an interest in heart disease. What I did see was that many of the patients that I encountered who had things like massive heart attacks, angioplasties, even open heart surgeries, actually continued to smoke. And I found that to be quite intriguing because after going through major events, why did they continue with that behavior? And so I decided to become a tobacco specialist in order to really assist people with giving them all of the tools and all of the information they might need to transition to becoming non-smokers. And I became a certified tobacco treatment specialist and have been doing interventions with people since then.
And when you were a young girl growing up, did you envision that you might become a nurse at some point?
That's always been the case for me as a young girl, yes.
Now, coming from the cardiac field, to being a nurse in the cardiac field, and then developing this specialty of tobacco, do you notice trends in Maine? I mean, do we have higher rates of smoking here in Maine?
As I said, it was rather intriguing to me that this group of folks with heart disease did continue to smoke, and I think it spoke really to the addiction and how difficult it was for them to make those changes. And as far as in Maine, the smoking rates, according to the 2012 CDC information, 18% of adults smoke. As far as high school students, 18% as well, and 7% in the middle school. For pregnant women, it's 19%. Something that's interesting to note, however, is that nationwide we've seen an increase in high school students smoking, and what they are doing is using the e-cigarette, the electronic cigarettes. So nationwide, we're seeing actually a rise in that group smoking because of the introduction of the electronic cigarette. Let me speak to that for a moment. It's a question that I am always asked, is this a safer method of smoking? Many people are attempting to transition from smoking cigarettes to using the electronic cigarette. Unfortunately, it's not FDA approved. We really don't know what is in the e-cigarettes. The other thing is many times people will say to me, well, it's only water vapor. Well, that is not true. What they're inhaling is propylene glycol, and we have no studies that have been done with long-term effects of inhaled propylene glycol. So that's a major concern, and I always say, we cannot support the use of these products because we just don't know enough about them. So it's an unfortunate thing that we're seeing. Many of the people I see who have bought electronic cigarettes, they end up sitting on a shelf because it doesn't feel like a cigarette, it doesn't inhale like a cigarette, and you don't get the same results from smoking that cigarette, so they end up not using them and they return to smoking anyway. But I think many people see it as maybe this will be a gateway to non-smoking, and that I have never met a patient who has quit smoking using the e-cigarette.
Well, I want to get back to e-cigarettes in a little while, but first I have a basic question. Why do people, when they know the health risks in this day and age, why do people start smoking?
Well, on the most part, adult smokers have started in high school. Nicotine is quite interesting in that for the high school population, it increases your alertness, When you smoke, nicotine reaches your brain in about 10 seconds. And what happens, a couple of things happen. First of all, you get a surge of adrenaline. So you feel much more alert, your blood pressure goes up, heart rate goes up, a sense of heightened alertness. The other thing that happens is that dopamine is released stimulates the release of dopamine, and with that, a sense of well-being. I feel happy, I really feel good. So every single time you smoke, this is what happens. Well, it doesn't take the brain very long to say, you know what, I need to feel this way on a regular basis, remembering that the half-life of nicotine is 2 hours. So typically 2 hours after you've had your first cigarette, you need to dose again in order to feel the same way. So this is where kind of that cycle starts. And then when on top of that you throw in the habit, remember that a habit is something that you do without giving any thought to it. So when you combine the nicotine addiction and the habit, it really becomes something that becomes a big part of your life, and it's hard to step away from it. As high schoolers, not only that sense of heightened alertness, but it really plays a role in helping to decrease that sense of aggressiveness. So high school, you feel good, you're alert, you're feeling less aggressive. Boy, that drug is working for you, and you continue to do so into adulthood.
Now, obviously, we've known for many years about the effects of smoking. Smoking is terrible for you. We've known that for years. And you've talked about some of the, sort of the mini high that it gives someone so they would start smoking. But what are the real effects? What are the things that make smoking so dangerous?
Well, what happens when you do have that increase in heart rate and increase in blood pressure, it really stresses your heart every time you smoke. It causes vasoconstriction of your blood vessels. So there's an increased risk of heart disease, strokes, cancers. Remember that 90% of lung cancers are smokers. Those people have a smoking history. The impact it has on your lungs, lung disease like chronic bronchitis, other chronic lung diseases as well. And those certainly play a role in your health. The other aspect to smoking that really plays a big role in many people's lives is the financial impact it has. When you consider that a pack of cigarettes goes for about $7 if you smoke a pack a day, that money really adds up. So that component of it as well.
Well, you've been working in this field for a long time. What disturbs you the most when you see, say, young people smoking?
Well, as I said, unfortunately, the cigarette companies will put out products that will entice the younger set to get started down that road. Nicotine addiction is difficult in that it really becomes a challenge to make those changes because your brain is physically craving that fix. The other pieces to that puzzle are the habits. Remembering yet again that a habit is something that you don't give any thought to, but think about smoking a pack of cigarettes a day. That's 20 times a day that you are engaged in this habit. The three components to quitting smoking, if you are thinking of making some changes, are the nicotine replacement, understanding that there are various products available to you, making some changes with habits associated with triggers, so knowing what your triggers are and making changes there, and then the psychological aspect of it as well, because most people who have smoked for a long period of time don't have any other tools to use when dealing with stress. They reach for a cigarette. That's their stress management. And think about it. It makes sense, doesn't it? You feel more alert, and yet you feel good. So it's a good stress management tool, not the healthiest, however. So making changes with that as well. So those are pretty much the three various components that are important to identify as you are thinking of making those changes. I tell people who come to see me who are looking to quit smoking, make sure that you have a plan in place. For those people who just get up one day and say, okay, today's the day I'm going to quit, will probably not be successful because they will encounter perhaps a trigger. At the end of a meal, you always have a cigarette. So what do you plan on doing the next time you have a meal? At the end of that meal, what are you going to do instead? So making sure that you identify all of your triggers for smoking, look at all of your habits associated with smoking, and really have another plan in place. Making small changes, interestingly, works with habits. Perhaps sitting in a different chair, perhaps not drinking coffee and drinking tea. So making some change to really break that habit and to introduce healthier habits. Remember that it takes typically 60 days to establish a new habit. So to really be thinking of that as you go forward.
Now, I'm sure you get asked this a lot, but did you ever smoke at one time?
It's funny that you should ask that question because it's the question that I get asked every single time I do an intervention with someone. And I understand where they're coming from because I think they want to make sure that I know how difficult it is. And I have to say, no, I have never been a smoker. But as I said earlier, I do understand how difficult it is. When someone has had open heart surgery and you think, my goodness, that is huge surgery, and returns to smoking, that tells me that it's so difficult for them. I had a patient not too long ago who said to me, and he had open heart surgery, and he said, you know what? Every time I look in the mirror, this is my motivation to not return to smoking, looking at his scar. And you know, I tell folks, do whatever you have to come up with the motivation to go forward and hang on to that motivation, whatever it may be. It may be a health scare. It may be whatever it is that works for you, but motivation, I do believe, is the key to success. I really believe that's it right there. If you really want to do this, it will happen. But I think you will have better success if you really come up with a plan, having all the tools that you need in order to go forward with this, because it is difficult, and I understand that.
You're listening to Southern Maine Healthcare's Medically Speaking with Robert Erickson. My guest today is Deborah Brown, a certified smoking cessation specialist at SMHC, and we'll be right back right after this brief message.
Not every boo-boo is an emergency, but it still feels like one. That's why Southern Maine Healthcare offers walk-in care. You'll find compassionate care at wonderfully convenient locations. Open 7 days a week, no appointment necessary. For those times when the unexpected happens, or you're just not feeling great, look for the orange ball as your sign of the best walk-in care. In Kennebunk, Saco, Waterboro, and Sanford, Southern Maine Healthcare, a member of Maine Health.
And we're back with our conversation with Deborah Brown. Deborah, you mentioned three things that are components in quitting smoking, the nicotine, the habit, and the triggers. Is there any one of those things that is the most important?
Well, let me speak to, so we talked about the nicotine addiction, the habits, and the third component of that was the psychological aspect. And I can tell you that for patients who've smoked and have quit for some of them long periods of time, what was the one thing that made them return to smoking? It was encountering a stressful situation, and they returned to smoking and said, you know what, I need a cigarette. I need to deal with this stress. and I always tell my patients this, one of the things, and I know they know this, I still have to say it, that you cannot have one more cigarette. Because typically, by the second day, you are right back where you started. And it's happened on so many occasions. So I always tell folks, you just can't have one more. But typically it's stress. Something happened, and they just go back to, I need that cigarette. Some of the barriers to quitting, some of the things that people tell me about are, first of all, fear of failure. Nobody wants to fail. And most smokers have smoked for a long period of time, but also tried to quit on between 6 and 8 times in their past. It might be a few hours, a few days, a few weeks, but they have made those quit attempts in the past, and that's discouraging. I certainly can understand that. So they don't want to fail again. But I tell folks, you know what? Use those as learning experiences. What did you learn from this? What worked? What didn't work? So that you can bring that to the table as you come up with your quit plan. The other ones are, for women in particular, fear of weight gain. They're afraid they're going to put on, you hear of people putting on 40, 50 pounds, and they're afraid of that. I don't blame them. There are two things related to that I want to speak to. First of all, typically the normal weight gain is about 10 pounds because your metabolism does slow a bit with when you stop nicotine. So there's a little bit of slowing of metabolism. The other component to this, however, is that for many people, they're using the hand-to-mouth gratification, but they're probably choosing not the best choices. They're, instead of choosing low-calorie foods, they're choosing on the most part, it's something really sweet because that helps with cravings. So depending on what choices you're making, it's easy to put on those extra pounds. So there's fear of weight gain, fear of just that you're going to fail. There's fear of, this is another big one. I've heard this on so many occasions, fear of losing your best friend. The first time I heard this, I said, what? But people have told me this over and over again, that they really have a relationship with that cigarette. And they've gone through so many experiences, good, bad, sad, whatever, with that cigarette. And they just are afraid of losing that relationship because I know it seems kind of crazy, but I've been told that on so many occasions. And a few years ago, I actually had a good friend of mine who came through the cardiac rehab program. She'd had a heart attack and had to have an angioplasty done, and she was a smoker. And she said to me, I always thought my cigarette was my best friend because I could always count on it. It always made me feel good until I had my heart attack. And then I realized my best friend was trying to kill me. And I thought, that is very profound.
Now, obviously, there are a lot of people trying to quit. What brings them to you? What gets them to the point where they come and talk to you?
I think for many people, they've tried everything, and I think I'm pretty much the last resort. They've tried quitting on their own. They've tried other things. But I sit with them, and as I said, I really encourage them to come up with a plan because it is something that is, you really have to put all of these pieces together of nicotine replacement. What are you planning on using? Most of the time, people have a pretty good sense of how they want to do this. I have the resources, but I never tell someone this is what you should do. It really has to be something that the patient believes in, and that's going to work for them. As I said, they've already had, on the most part, past quit attempts, so they have a sense of what's going to work and what's not. So the first thing that we talk about is, and I will ask them, what do you plan on doing for nicotine replacement? I think the use of as many of these products that you need to be successful, I think you should use them, because you want to get through this process with the least amount of discomfort. Some people do quit cold turkey. Good for them. You know what? They were motivated by whatever it was that happened at that period of time, and they were successful. However, having a plan and addressing all of the different components, I think, is also important. So the first thing that we talk about is nicotine replacement. And I will offer them the various options out there. The patch, so you continue to replace nicotine for a period of time. The patch comes in 21 milligrams, 15 milligrams, or 7. It depends on how much you smoke. If you're a pack-a-day smoker, then I recommend the 21 milligram patch. So in the past, we were much more strict about, you do this, this, or this. And now we say whatever you need to get through this is really what's most important. So if someone smokes a pack a day, 21 milligram patch, you rotate it, move it from one arm to the other, because nicotine does cause irritation of the skin. But you can use as many of those tools and nicotine replacement products as you need. Now, for the nicotine gum, making certain that you chew it until you get a peppery taste in your mouth, and then either park it in the side of your mouth or take it out. You don't continue to chew it as you would regular gum. The same with the lozenge. When you get that peppery taste, you can take it out, but I believe they have newer lozenges that melt more quickly. Now, the other products that are available are Zyban. It's a product that we've used for a number of years, or recommended for a number of years. Zyban works to help with cravings, as well as help with depression. Many people who go through smoking cessation feel pretty sad. Again, they've lost their best friend. They're feeling sad, depressed. It's okay to use a Zyban in order to get through that piece of it. And as I said, it also helps with cravings. Zyban is only with a doctor's prescription. And if you do have a history of seizure disorders or eating disorders, your doctor would not give you this product. And the other thing that I wanted to speak to is Chantix, which is a product that is very different from the others. Chantix works to actually block the nicotine from reaching those receptors in your brain, so you don't get those feelings of, gee, I feel really alert and I feel really happy now. So it actually blocks that. And at the same time, it does give you that helps with the cravings, so it deals with that as well. And I have seen wonderful success with the use of Chantix. Many of the folks that I've known have used Chantix as a last resort. They come to me and say, I have used everything and not had success, and the Chantix really did a great job. Again, it's available only through a prescription, and your doctor will screen you as well to see if you are able to take the medication. Certainly, if you have a history of severe depression, he probably would not be prescribing this for you. The biggest side effect with the use of Chantix is typically that people are sick to their stomach. So nausea is the biggest one. And I always recommend taking it with a big glass of water. And the other thing is not to give up on the Chantix because of things like nausea or vivid dreams. Perhaps you can even adjust the dose, but continue to use it. But it really has helped so many people to achieve success that it works really well for a certain group of folks.
Now, with all these products that supply nicotine to the brain, is there a danger of being addicted to these other products? And is there a weaning off period that people go through?
There is typically a weaning of the medication. However, I encourage to have people stay on the products longer, typically, than the doctor recommends. Again, you have to remember that folks who've smoked have smoked for many, many, many years. Smoking cessation is a process. When you quit smoking, it's a process, not an event. And I do recommend taking quite a period of time to get through that process in order to, so you're addressing the nicotine replacement, but it takes a while to address the habits and making those changes in your habits. So I recommend using the products over a period of many months if you need it. If you need the products for 6 months or even longer, you're still making healthier choices. So I absolutely recommend staying on these things for as long as you need. Remember that when someone quits smoking, they are considered to be a non-smoker only after a full year of not smoking. Why do I say that? Because that person has to experience everything that they do in their lives now as a non-smoker. So think about that. Family gatherings, you go to parties, you go to events, people who use their cigarette as a reward after doing the raking and the yard work. So all of that you have to now experience as a non-smoker. So it takes that full year. And I always tell my patients, really try to always be prepared. Don't be caught short. 6 months from now, perhaps you're not using any nicotine replacement. You feel really good and you feel really confident, but still be on your guard. And try to think of, okay, is this perhaps going to be a trigger? Many times people are just caught short, and it's not that they need the nicotine. However, there was some trigger that makes them want another cigarette.
Could you share a success story that you've had with a patient?
There's one fellow who really comes to mind that this fellow was unbelievable. He was in his early 40s. He was a smoker with 2 young children, and he was smoking. He was hiding his smoking. So he'd go in the basement and he'd go here and there and smoke. And then finally, one of his children, unbeknownst to him, his children did know that he smoked, and he was just really upset with that and said, you know what, I need to make changes. And he came to see us, and we helped him through the process. And I believed he used the nicotine patch and the gum, and so he got through the process. But he made such huge behavior changes and ended out, perhaps it was a year later, he started really getting into exercise, and a bit later from there, he went on to become a triathlete. So talk about making huge changes in your life. So those stories like that really make us feel that we've made a difference in someone's life. And he was certainly very thankful that we were able to help him through the process.
So, Deborah, if somebody wants to speak with you or a specialist at Southern Maine Healthcare, how would they go about doing that?
What happens is that people call me and I make an appointment, and anyone can sit with me. I will sit with folks for as many sessions as they would like, and I just really help them come up with a plan, give them all of the options that are available to them, and from there, one of the important things to do is you come up with your quit plan is to make sure that your environment is ready. Clean out your home, your car, make sure you get rid of your ashtrays, make sure you get rid of your cigarettes on the day that you are set to quit. Having a quit date, making sure that date is happening at some point in time. So setting that date, something that's important to you, and then we can go from there. But my phone number is, if anyone would like to call me, and I'm right at the Southern Maine Healthcare in Biddeford, is 283-7908. The other thing that I do recommend is that people also have the opportunity to make a call to the Maine Tobacco Helpline, because they do have trained tobacco treatment specialists there as well. And if you qualify, they'll be able to supply you with nicotine replacement products. So that number is 1-800-207-1230. And if you would prefer to do something online, there's also the quitlink.org.
Well, we've run out of time for this week. My guest today has been Deborah Brown, a certified smoking cessation specialist at SMHC. Deborah, thank you for sharing some time with us.
Thank you so much.
Join me next week at this time for a new guest and an enlightening discussion about healthcare in our communities. Brought to you exclusively by Southern Maine Healthcare, your trusted resource for healthcare in Southern Maine.